Let's talk syphilis testing, because it's almost as complicated as the Big Bang Theory, if you ask me. I'll explain the main tests and what their results mean. First, we have non-treponemal tests like RPR or VDRL. These screen for syphilis by detecting antibodies from cell damage, giving results as titers like 1 to 16. Higher titers suggest active infection, but false positives can happen with conditions like pregnancy. Next, treponemal test like the fluorescent treponemal antibody absorption test or the treponemal palladium particle agglutination test confirm syphilis by detecting specific antibodies. They're more accurate, but they stay positive for your whole life, even if you've been treated. Labs typically use two algorithms. The traditional one starts with a non-treponemal test, like an RPR, then confirms with a treponemal test. The reverse algorithm screens with a treponemal test, then uses a non-treponemal test, like RPR, to test if the infection is active. Interpreting the results is the tricky part. Let's say both tests are positive, so your RPR and your TPPA both came back positive. It's likely an active infection. What happens if only the non-treponemal is positive, like the RPR, and the TPPA is negative? It's likely a false result, like from pregnancy. What about if only the treponemal is positive, like the TPPA? This could mean either early infection, treated syphilis, or late stage. The titers that come from RPR are a measure of infection strength. High titers, like 1 to 32, mean active disease. After treatment, we look for a fourfold drop, like 1 to 32 to 1 to 8, within 6 to 12 months to confirm success. Other tests include dark field microscopy or PCR for early sores, and CSF VDRL